Hi, I'm Raymar B. Callado from Section Weidenbach. For this video, I will perform wound care. But first, what is wound care? Wound care is the aseptic cleaning of wounds. For the assessment, assess the situation to determine the need for wound cleaning and the dressing change. Confirm any physician orders relevant to wound care included in the nursing plan of care. Assess if the patient experienced any pain prior dressing change and what intervention were employed to minimize the patient's pain. Assess the current dressing to determine if it is intact. Assess the excess drainage or bleeding or saturation of the dressing. Inspect the wound and surrounding tissue. Assess the appearance of the wound for the approximation of the wound edges, the color of the wound and the surrounding area, and the signs of dehiscence. Note the stage of the healing process and the characteristic of any drainage. Assess the surrounding skin for color, temperature, and edema, ecchymosis, or maceration. For the objectives, first, to promote fast wound healing. Second, to remove debris or damaged cells. Third or last, to prevent bacterial growth and complication. In general consideration, we have methods of wound care. For the open wound, wound care without the use of dressing. For the closed wound, involves the application of a dressing. For the equipment, dressing tray containing the following: sterile gloves, gauze dressing, sterile dressing set or suture set for sterile scissors and forceps, sterile cleaning solution as ordered, commonly 0.9% normal saline solution, clean disposable gloves, sterile basin may be optional, sterile drape may be optional, plastic bag or other appropriate waste container for soil dressing, waterproof pad, and bath blanket, tape or ties, surgery pads or ABD pads, additional dressing and supplies needed or required by the physician order. Step 1. Review the physician order for wound care or the nursing plan of care related to wound care. Reviewing the order and plan of care validates the correct patients and correct procedure. Step 2. Gather the necessary supplies. Preparation promotes efficient time management and organized approach to the task. Step 3. Identify the patient. This ensures the right patient receives the right intervention. Step 4. Explain the procedure to the patient. Discussion and explanation help allay anxiety, encourage patient cooperation, and prepare the patient for what to expect. Step 5. Assess the patient for possible need for non-pharmacologic pain-reducing interventions or analgesic medication before wound care dressing change. Administer appropriate analgesic consulting physician's order and allow enough time for analgesic to achieve its effectiveness. Pain is a subjective experience influenced by past experience. Wound care and dressing change may cause pain for some patients. Step 6. Perform hand hygiene. Hand hygiene prevents the spread of microorganisms. Step 7. Close the room door or curtains. Place the bed at an appropriate and comfortable working height. Closing the door or curtain promotes privacy. Proper bed positioning helps reduce back strain while you performing the procedure. Step 8. Place a waste receptacle or bag at a convenient location for use during the procedure. Having a waste container handy means the soil dressing may be discarded easily without the spread of microorganisms. Step 9. Assess the patient to a comfortable position that provides easy access to the wound area. Use the bath blanket to cover any exposed area other than the wound. If necessary, place the waterproof pad under the wound site. Patient's positioning and use of a bath blanket provides for comfort and warmth. Waterproof pad protects underlying surface. Step 10. Check the position of drains, tubes, or other adjuncts before removing the dressing. Put on clean disposable gloves and loosen tape on the old dressing. If necessary, use an adhesive remover to help the tape off. Checking ensures the drain is not removed accidentally if one is present. Gloves protect the nurse from contaminated dressing and prevent the spread of microorganisms. Adhesive tape remover helps reduce patient discomfort during removal of dressing. Step 11. Carefully remove the salt dressing. If any parts of the dressing stick to the underlying skin, use small amount of sterile saline to help loosen and remove. Do not reach over the wound. Cautious removal of dressing is more comfortable for the patient and ensures that any drain present is not removed. Sterile saline provides for easier removal of the dressing and prevents tissues damage and minimize pain. Step 12. After removing the dressing, note the presence, amount, type, color, and odor of any drainage on the dressings. Place soil dressing in the appropriate waste receptacle. Remove your gloves and dispose of them in an appropriate waste receptacle. The presence of drainage should be documented. Proper disposal of soil dressing and used gloves prevent spread of microorganisms. Step 13. Inspect the wound site for size, appearance, and drainage. Assess if any pain is present. Check the sutures, steri strips, staples, and drains or tubes. Note any problem to include in your documentation. Wound healing or the presence of irritation or infection should be documented. Step 14. Using sterile technique, prepare a sterile work area and open the needed supplies. Supplies are within easy reach and sterility is maintained. Step 15. Open the sterile cleaning solution. Depending on the amount of cleaning needed, the solution might be poured directly over gauze sponges over a container for a small cleaning jobs or into a basin for more complex or larger cleaning. Sterility of dressing and solution is maintained. Step 16. Put on sterile gloves. Use of sterile gloves maintains surgical asepsis and sterile technique and reduces the risk for spreading of microorganisms. Step 17. Clean the wound if needed. Use sterile forceps to clean the area. Clean the wound from the top to the bottom and from the center to the outside. Following this pattern, use a new gauze for each wipe, placing the used gauze in the waste receptacle. Do not touch any surface with the gloves or forceps. Cleaning occurs from the least to the most contaminated area. Using single gauze for each wipe ensures that the previous clean area is not contaminated again. Step 18. If a drain is in use, clean around the drain using a circular motion. Wipe from the center toward the outside. Use the gauze a single time and then dispose of it. Cleaning occurs from the least to most contaminated area. Step 19. Once the wound is clean, dry the area using a gauze sponge in the same manner. Apply ointment or any other treatments if ordered. Moisture provides a medium for growth of microorganisms. The growth of microorganisms may be retarded and the healing process improved with the use of ordered ointment or other application. Step 20. Apply a layer of dry sterile dressing over the wound. Forceps may be used to apply the dressing. Primary dressing serves as a wick for drainage. Use of forceps helps to ensure that sterile technique is maintained. Step 21. Place a second layer of gauze over the wound site. A second layer provides for increased absorption of drainage. Step 22. Apply a Surgi pad or ABD dressing over the gauze at the site as the outermost layer of the dressing. The dressing acts as additional protection for the wound against microorganisms in the environment. Step 23. Remove and discard sterile gloves. Apply tape or tight tapes to secure the dressing. Tape is easier to apply after gloves have been removed. Proper disposal of gloves prevent the spread of microorganisms. Step 24. After securing the dressing, label dressing with date and time, remove all remaining equipment, place the patient in a comfortable position. Recording date and time provides communication and demonstrate adherence to plan of care. And perform hand hygiene. Hand hygiene prevents the spread of microorganisms. Step 25. Checking all wounds dressing every shift. More frequent checks may be needed if the wound is more complex or dressing becomes saturated quickly. Checking dressing ensures the assessment of changes in patient condition and timely intervention to prevent complication. For the evaluation, first client demonstrate progressive healing of wound as evidenced by the following: wound edges closing together, reduced swelling and redness of wound edges, reduction in amount and color of drainage, decreased wound pain. Second, remains free of infection with normal temperature (WPC), absence of wound swelling, odor, and purulent drainage, and no increase in pain. Third, or last, client practices self-care behavior to promote healing by the following: washing of hands appropriately, keeping hands away from wound drainage and dressing, maintaining as maintaining a well-balanced diet as order. Clients verbalize and demonstrate understanding of wound and dressing care. And for documentation, time of dressing change and type of dressing, amount, color, consistency, and odor of any drainage, specific assessment parameters including condition of skin, drain site, and incision time, the patient's reaction to the procedure, including any pain experience, any patient and or family teaching done, and level of understanding.